Hello, everyone. Welcome to our live feed. This is amazing. We have some amazing people on our panel. And I think we really need this, right? We really need this. I'm going to be on my computer, keeping up with everything. But make sure you let everyone know to come on in. Um, we're getting ready to introduce everyone. I'm going to put it on the speaker's view so you can see our wonderful, wonderful people. I mean, we have some people on here. I mean, some organizations. Oh, we look beautiful. Hi, everyone.
Hey, Ian.
Hello.
Hi. Yes, let's go ahead and we're going to, I'm going to share real quick on my page before we get ready to start. I just think this is so amazing that we're here sharing a group. So, okay, I think we should get started. People are joining in. Hello, everyone. Hello, this is a dream come true. I want to start a watch party by myself.
So you actually have to approve us to do the watch party, sir?
Oh, I do.
Yeah.
So amazing. I do. I'm sorry, and I don't see it. That'll be something for next time. Okay, I think we should get started. People are joining in. Hello, everyone. Hello, this is a dream come true. It's one. I want to start a watch party. Listen, okay, there we go. Technology, technology, technology. So I am your moderator for today. I am Ian L. Haddock. I am the Executive Director of the Normal Anomaly Initiative. I am joined here today by some amazing people going to have an amazing conversation around LGBT and COVID-19. I know there were many questions that we had surrounding COVID-19 as it relates to all the issues that we exist within the LGBT community. And so me and Reese Caraway came together along with my team to create a space to have this conversation around LGBT and COVID-19. So before I can get started, I would like to give our panelists a chance to introduce themselves. If we could start with Latrice.
Hey everybody, my name is Latrice Mason. I am a family nurse practitioner and I am helping eradicate HIV and AIDS at the AIDS Foundation. I help at the PrEP clinic to make sure our patients are taken care of and getting them on Truvada and Descovy.
Amazing, amazing. I actually take Descovy. I love her. So, Stephen, if you could introduce yourself.
Yes, hey everyone. This is Stephen Vargas. I am a person living with HIV for the last 25 years. I have helped out with a number of things here at the city, state, local, national level, trying to make some changes to help everyone. Thank you.
I could not find a better way to introduce Stephen other than national activist on the flyer. That was the one that I gave. Couldn't find anything better. My love, the beautiful Shadon McCants.
Hello, everybody. I'm Shadon McCants, licensed professional counselor, also beautiful, bold Black woman living with HIV. So I am here to discuss all things HIV and African-American woman living and thriving with HIV.
Absolutely. And that she is, as you see, this rose in the back of her. My friend, my confidant, my vice president, my researcher, sometimes my doctor, Jonathan Joya, MD.
Oh, hello everyone. How are y'all? So yes, my name is Jonathan Joya. I am an MD. I'm a doctor and I'm HIV researcher at UT. And also mainly just I focus on HIV prevention. Now we're just dealing with the injectable PrEP study and everything here in Houston. And also a community activist, absolutely proud to be in leadership as vice president for Impulse Group Houston, and also for the Latinx community as Loud president.
Yay! Listen, this baby don't sleep and likes it like that. This is my girl. She introduced me to a completely different world. I couldn't be happier to be connected to the beautiful, and, look at the new hairdo, Crystal Townsend.
Oh, that was a sweet introduction. Hi, everybody. I am Crystal Townsend. I'm the coordinator for NHIV Houston. It's a community grassroots driven plan focused on ending the HIV epidemic in Houston, Harris County. Thank you for inviting us here.
Thank you so much for being here. And then I also want to, oh my gosh, like I'm kind of intimidated with him being on. He is like the T to me, Dr. Daryl Shorter.
Thank you. You're too much, too kind. My name is Daryl Shorter. I am a psychiatrist here in practice in Houston, and I specialize in treatment of lots of different kinds of psychiatric conditions, but I really focus and specialize in addictions care, in addition to overseeing a training program and working at the VA hospital. I'm really happy to be here with you. Thanks.
Thank you so much. This is, the next person is my uncle. Yes, we have a lot of people on here because we have a lot of information to give within the next hour and 15 minutes. This person is my uncle. He is the trailblazer that I hope to be in the next 20 years. Grateful to be connected to him and for him to call me nephew in public. I know a lot of people call me things in private, but thank you for calling me nephew in public, Uncle Jeffrey Campbell.
Thank you, Ian. Thank you. Welcome to all who are tuning in this evening and to those who will watch this video later on. I do know that it is going to be posted on AIDS Foundation Houston's website shortly. So thanks to Ian and to Reese for putting this together, and they are both my babies. Thank you for your ingenuity and your passion for our people. So I am Jeffrey Campbell, and I am the Chief Program Officer for AIDS Foundation Houston. We are a 38-year-old AIDS service organization, the first in the state of Texas. I've been around this work now for almost 2 decades. I think it's been 17 and a half years. And I've been allowed to be in many spaces and places. And right now, although I have a level of anxiety about COVID-19, I am glad that I am able to be a part of the work that we are doing at AFH to assist our clients, our patients, and our community in maneuvering through this very critical time.
Thank you so much. I am trying to, oh, my heart used to be my boss. Now, the former non-binary Grand Marshal, the current president of the LGBT political caucus, a person I can call, a person that will call me if he hears anything crazy at any moment, just to make sure I'm protected because he loves me that much. Like a big, I don't know, bister. Can I call you a bister?
Comfortable to you.
It's my
Hi, everyone. Thank you for having me here. So yes, I'm Mike Webb. I'm currently the president of the Houston LGBT Political Caucus. We're the oldest and largest LGBTQ civil rights organization in the entire South. We do a good job of not only electing candidates that's going to fight for the LGBTQ community, but also holding them accountable, which is how we gather the information we're going to present to you all today.
I mean, when I tell you my heart is full, and I could not have done this without this next incredible person who's not only going to introduce themselves, but also introduce why we're here. He is why we're here. And I want to introduce you to incredible Reese Caraway.
Hey, good evening, y'all. My name is Reese Caraway. By day, I'm a public health educator with the Houston Health Department. But tonight, I'm just your friendly neighborhood butch queen who has some information to give out. So if you know me, you know my community is and will always be one of my top priorities. I just love y'all so much. But there has been a lot of questions that us as the public in general have had surrounding COVID-19 and how we're responding as individuals, how we respond as organizations, and how we are responding as a marginalized population. And I wanted to do something about it. So of course I called Ian, and he rallied up some of the most amazing people in Houston and brought them together. And now we're here. So my hopes for tonight is that any questions that you may have or have now, that we can give you some really good information to help you navigate healthcare, to navigate mental health, to navigate self-care, and just for all of us to be in community at this time.
Thank you so much, Reese, for your idea, for your thoughts, for your passion for the community. And I want to tell you that you are not overlooked, that we do see you, we do see your work, and we are grateful for it. I want to get right into the conversation. At the top of the conversation, I think that we should begin with understanding COVID-19. As a person who worked in public health forever, but didn't immediately understand the ideas of physical and social distancing, which we'll talk a little bit about the difference that may come up with physical and social distancing. I wanted to start with Jonathan Joya and ask him, what exactly is COVID-19?
All right, let's get it on. So COVID-19, I would just do it as, I would just say that, let's just start with the fact that it's a virus, okay? And because we gotta put that basic information out there. So basically a virus is just a very, very tiny piece of genetic material that by itself does absolutely nothing. So that piece of genetic material needs to get to your cells in order to reproduce itself and just make more and more and more and more copies of it. And while doing that, as it just gets to your cells, it destroys them, right? So coronavirus, why do we call it corona? Because that piece of genetic material is also surrounded by an envelope that has different proteins, and those proteins are spikes. And those spikes look like a crown, right? So in Spanish, from Latin, corona means crown. So that's why it's named coronavirus. And it's named coronavirus 19 because it has started in, they first discovered, let's just say in China, in Wuhan, in December 2019. So that's why we know that. But again, just to say that coronaviruses is a big family of viruses, and this is just a particular strain that it's also known as SARS-CoV-2 because it means severe acute respiratory syndrome, which is what it causes. Because again, just to go back to the basis that I was just talking about, some viruses need some certain type of cells. So for instance, if we think about HIV likes infecting immune system cells, and the coronavirus has this liking, let's just say, for respiratory cells. So that's why the main symptoms, if you get infected, are respiratory ones, meaning cough, shortness of breath, and then when your body starts attacking everything, it causes fever, right? So that's like the big picture of what coronavirus, COVID-19 is in general. And yes, as we do know, it's fairly new. So we know that, there's no treatment right now, there's no vaccines right now, but we're dealing with it. And again, it's transmitted by droplets, air droplets. So, and now we're just starting to understand a little bit more about it, and how much longer it stays in the surfaces, and so on and so forth. So that's where, as the more we learn about it, the more we can also change our guidelines and everything, which is like a very dynamic situation as it changes every day.
Thank you so much for that, Jonathan. I really appreciate that. So I wanted to ask Latrice, what is the research currently saying about COVID-19?
So basically, I really kind of wanted to start with some of the stuff that people kind of already know, like some of the symptoms that the doctor was talking about earlier, like fever and cough and shortness of breath. Usually that happens between 2 to 14 days from exposure. And usually whenever it gets worse, like with difficulty breathing or chest pain or pressure, is really when people need to start to go to the doctor if they have like bluish lips or confusion or inability to be aroused. We also have found that, like he was saying, that it's it's from person to person, which is why social distancing is being enforced and why it's so important for us to actually stay home. The respiratory droplets is, just like he was saying, is really the way that it's being transmitted, and not so much what a lot of people are saying that it's airborne. The airborne is something like tuberculosis or chickenpox, things like that. It is not airborne. It is definitely respiratory droplets, which basically means if someone coughs or sneezes, or if they talk and that gets into your eyes or nose or mouth and goes into inhaled into your lungs, then that's the way that it's transmitted. But some of the other research that they found, when people are talking about washing their hands, everyone is on this hand sanitizer, and I think that that's a great thing to be on. But the very best thing that you can do for yourself is washing your hands is the first line. Hand sanitizer is kind of like the second line if you can't get to a sink with soap and water. I don't want people to forget that the soap and water is actually the first line, and hand sanitizer is the second line. And then with the masks, the CDC has actually really said that if the people who really need masks are healthcare providers who are around people who are actually sick, and if you're caring for other people who are sick, or if you are sick. Now, they are starting to change that. The research is showing that more people are needing to wear the mask because a lot of people are walking around with the virus without any symptoms. So it's really hard to tell if anyone has the virus. So it's better to start to wear masks more often than not. So that's kind of where research is going.
Thank you, Latrice. So appreciate you. You always break it down. You and Jonathan always break it down in a way that makes sense for the people. So I hope you all receive that. Wash your hands. Okay? But coming into this next conversation, so with this COVID-19 situation, what we're hearing a lot about is the economic disparities that for people that were in crisis, like LGBT people, like Black and brown people that were already in crisis economically. What does this mean? So Mike, I want to ask you, why is it important for us to listen to elected leadership surrounding this pandemic, even as it relates to things like the stimulus and staying inside and things like that?
Absolutely. So the first thing I think is important for everyone to know is that your elected officials, especially your local elected officials, I know everyone's probably watching from different parts of the country, but your county and your mayors are going to be the elected officials who have the most updated information about what we should be doing and what type of behaviors we should be adopting as we try to collectively fight or combat COVID-19 as a community. I know it can be a little confusing, especially when you hear different messaging from your president, for example, and then the governor of Texas says something ridiculous. And that's why I always encourage folks to pay attention to your local elected officials more than necessarily sort of the president of the United States, unfortunately, at this point. Mostly because President Trump has been fact-checked so many times already. NPR has agreed not to even run his press conferences anymore because of the inaccuracies in his descriptions of what's going on and sort of the policies his own government is implementing. In Harris County, Judge Alina Hidalgo has been providing excellent real-time guidance on how communities should be, type of social practicing that this community should be adopting, including social distancing and reminding constituencies that we should not be in large gathering spaces, et cetera. These types of guidance are gonna be on a rolling basis. We just found out a couple of days ago that they're extending the recommendations until April 30th. It's likely gonna extend further than that as well. So it's really important to focus on them. I know that I have a natural distrust of government, and a lot of our community members, especially LGBTQ community members and Black community members, have a natural distrust of government. In this particular time, I would say that we have to put faith in the people who we elected, especially locally, because even if they're not part of the party that we necessarily traditionally support, they're the ones that the scientists and doctors and people at the Texas Medical Center are all reporting to, giving them real-time information on where the pandemic is and how to best combat it in real time. As it relates to the stimulus package.
Well, let's come back to the stimulus package.
Okay.
Let's come back to that, because that brought up something for me when we're talking about this physical and social distancing.
Yeah.
I am interested, Latrice, if you could answer, how does this virus affect me if I am a person that has something that compromises my immune system?
Well, if your immune system is already compromised, then you a disadvantage than someone who isn't immunocompromised, which means you can't recover as quickly as someone who isn't. And those persons would be someone who maybe is 65 or older. If you have like a chronic lung disease or asthma or heart condition, someone who's HIV positive, or even someone who has like lupus or diabetes, or even severely obese. People don't really think about someone who's homeless or dialysis or liver disease, things like that. Your body really can't take a hit like a coronavirus if your immune system isn't really prepared for a disease that will kind of take it out.
Yeah, and that brings up a really important piece, right? So in this space, we're dealing with all of these different intersections of like crises. This pandemic has brought up a lot of different things for us. And so for me, I deal with depression and anxiety on a regular basis. I have a lot of like different disorders. I'm in sex therapy and I'm in regular therapy, and I can't afford all of that. So my next question is to Shadon McCants. How do we cope with the anxiety of social distancing?
Oh, Jesus. Thank you again for this platform tonight, Ian, for us to all come together and have this conversation. How do we cope with the anxiety? That's really a complex question. I think we all on here, if we're all honest, everyone that's on this call, we're all dealing with some level of anxiety right now. COVID-19 is a beast. It has brought about more than just our usual forms of anxiety. Like you said, like you, Ian, I, even as a professional, licensed professional counselor, I have my own diagnosis of anxiety and depression that I've dealt with and I've lived with since I was 12. And so we know that COVID-19 has exacerbated anxiety. It's a different form, if we should say. It's to the level where we're not dealing with the just usual daily worry. We're actually dealing with the uncertainty, the unknown, the fear of what we don't know is getting ready to happen. Where we normally know if a hurricane or a tornado or something happens, we know, most likely we will survive, especially if we live to see the next day. So how are we coping? Some of the things I'm encouraging my clients, and especially myself, is just to breathe. One of the biggest things I think in this season is to, one, breathe, and also just deal with what you can deal with in the moment.
Can you, for a moment, Shadon, for 20 seconds, do a breathing exercise, 20-second breathing exercise with everyone on the call, real quick.
Okay, and so I think we all, if I would say anything, is just one, relax yourself now, sit back where you are, just sit in your space. And everybody on the call, I need you to take the deepest breath in and take that breath. And while taking it, hold it for 3 seconds. And now I want you, after 3 seconds, to slowly exhale. And while exhaling, I want you to think about something so peaceful. If nothing, just think about the breath that you just took.
Yeah.
And if we just, again, and I know we're limited with time, but that's something that, if I know a lot of us, depending on who's on this call and those of us that are sitting here, if you have an iPhone or a Fitbit, more than likely your watch tells you to breathe. Before COVID-19, you would see it say breathe and you would be like, oh, okay, and you would keep going. One of the things is I think in this season is to really be intentional about the breath that you take. For me, when I'm taking that breath and when I'm coaching and counseling with my clients, is to be intentional about that breath, and just sit and just allow it to just fill your lungs. And then when it exhales, just let go of whatever it is in that moment that may be worrying you or stressing you in that time frame. So that's just one of the biggest coping skills that I would give. And the other one is to go outside If it is nothing else but to step out in front of your front door, to step out if you have a balcony, just go outside and just get some fresh air. You know, no one's telling you that you cannot do that. Social distancing is not prohibiting you from just going outside and experiencing nature and realizing when you step out that you are still alive.
Yeah.
So, you know, those are some of the things that I definitely encourage individuals to do in this season, is to just breathe, step outside, get you some fresh air, but also just understand that you can only deal with what you have control over right now. So that's what I would tell you to do.
So much for that, Shadon. I think it's important that we understand the difference in physical distancing and social distancing. I was on a call with the LGBT Political Caucus, which Mike leads, and we were having a conversation yesterday with Kendrick Clark, who's also a nurse practitioner, and he was saying that the difference is, like, what we're hearing is social distancing, but we want you to be social. We want you to be social in a safe way. So that's why Zooms, that's why live, that's why social media, that's why going outside is so important, right? Because we're not trying to take you away from society, because society and community is what builds us. It's what loves on us and nurtures and cultivates us. What we want you to do is to be physically distant so that you can be safe. And so that goes into my next conversation, because I think safety is about how we cope and how we deal with the stressors that we see. So I want to ask Dr. Daryl Shorter, what options do we have as a community to see a mental health professional if I have never engaged with the system, never been to see a psychologist, a psychiatrist, or a counselor?
Yeah, thank you again, Ian Reese, for arranging this. And this is a really important question, so I made notes for myself. I typically encourage people to think about what their options are in terms of insurance versus non-insurance. So I'm going to break this down into those two buckets. So if you are someone that has insurance, the first thing that you can consider doing is contacting your insurance carrier, your insurance provider, to find out what your mental health benefit is. There are lots of different ways that insurance companies cover mental health care. So as annoying as it is to call or get on the phone with them and be on hold for 20 minutes to 20 hours, they really are probably one of the first places that you should go if you have insurance, so that you can find out what kind of benefit you have. Some folks have a benefit where they can see a counselor for 6 times or for 12 times. This is getting a little bit better as we are seeing mental health parity in our country, but there's still much work to be done. So figuring out what's covered, I think, is probably one of your first hurdles. The second one is to find a provider that is covered by your insurance. And now you certainly can use your insurance to see someone who is, quote, out of network, meaning that that provider doesn't use or doesn't take your insurance, but you can still see that person. And if they give you a bill, you send it to your insurance company and your provider will be reimbursed for some portion of that. So there may be a little bit of an out-of-pocket part for you to pay, but just because someone is not in network doesn't mean that you can't see them, even if you have health insurance. So start with your resources and go from there. I also tell people that have health insurance to look at psychologytoday.com. Why? Because they have an easy way for you you click on the tab, find a therapist, and you have options for how to select a therapist based on the kind of insurance they take, based on zip code, and you can click LGBT, because there are psychologists and therapists and psychiatrists who specialize in working with our community, and they identify themselves as such. And if you put those things in, you'll get a list of people that are in your geographic area, close to where you live, close to where you may work, and you can go in that direction. It turns out that the ways that we have accessed mental health care really haven't changed as a result of COVID. What has happened is that our ability to engage virtual or telehealth or telepsych services has gone up. All of the clinics that I know, and some that I don't know, are trying to figure out a way to see clients virtually. And so pay attention to that as well as you're reaching out to folks. How can I see you? Can I do a new patient evaluation via phone? Do you have video equipment so that we can do this like we're doing this right now? And how can I access care without having to come in? That's pretty important. One of the local places that I'll speak about for Houston in particular, that deals specifically with the LGBTQ community, is Legacy Community Health. They have psychiatric providers, they have counseling services available, and you might consider them. Okay, now for folks that may not have insurance, it can be a little bit dicier, but it's still possible to find good mental health care within the city of Houston. So couple of places that you might think about: Harris Health System. They have a number of clinics, both that are hospital-based as well as community clinics. The Harris Center for Mental Health. Again, you can go to these websites, check them out. They list their eligibility requirements. Sometimes that can include just proof of residency in the county. You might need an identification card. So again, when you're going through, just see what they require in terms of proof of eligibility. They also will provide financial assistance. They'll slide the fee, or they can even have some charity care that they can give you so that you can get in. If you're a person living with HIV, if you happen to receive services through Thomas Street Clinic, which is part of that Harris Health System, they have psychiatry providers there as well, mental health providers. And finally, the Montrose Center, which is our city's LGBT behavioral health center. They are doing virtual visits. I know that they have telepsych that's available. On their website, there's an electronic intake form that can be downloaded. You can complete that form as well as the eligibility documentation and upload it to the system without even having to go in or make a phone call. So tons of opportunities that are out there to access care. One final thing is you can just Google teletherapy. I mean, we are living in an age right now where we are seeing an explosion of mental health counseling and therapy options that are available via various platforms, through phone or Zoom or what have you. And so sometimes what you might be able to do is pay like a monthly fee for some of these services. And that monthly fee might be within your budget, and you have access to being able to talk to someone, text with someone, or use a Zoom interface with someone who you can have access to while also practicing social distancing. So hopefully there's something in there that you can find that will work for you.
Yes, thank you so much for that, Dr. Daryl Shorter. I think all of those are important things, especially me as a self-employed individual who does not have insurance. It's super important for us to know ways to get around accessing care. Montrose Center has been so valuable to me in accessing care. So Shadon, if you're back, I wanted to ask you a question. I know that you spoke at the beginning of this conversation around your personal HIV status, that you're living with HIV. And so I know that both professionally and personally, you walk through this world mitigating risk of different things. So when we talk about COVID-19, how are you both personally and professionally beginning to mitigate risk, if you would?
For me, it's, I think I spoke a little bit personally on my own live, but I will address that here for the individuals that are maybe living with HIV, such as myself. It's been something that initially was kind of breathtaking, because as for me, and I speak as a woman living with HIV for 24 years, I don't wake up in the morning and think that I'm Shadon McCants, the woman with HIV. I wake up Shadon McCants, a bold, beautiful Black woman getting ready to conquer the world. And so for me, COVID-19 came with, okay, reality check. You know, you do have a compromised immune system, or at least that's what you're told, because again, it's kind of me, an individual who believes in the science. And that's a whole nother, video and conversation we can have about what U equals U means, undetectable equals untransmittable, how to live a life that you're very healthy and your immune system is fighting and energized. So for me, I do still recognize that. And so for me, it's kind of now a daily reminder. So I definitely am very precautious. And I can real quickly, I'll show you guys. This is what my day looks like when I leave my home. I have an N95 mask that I wear everywhere I go. I have surgical gloves or blue gloves that I wear everywhere I go. People are not allowed or welcome into my home. I'm pretty much isolated in this space. I do go out, I go to the grocery store, but when I go out, again, I'm going out with my mask, I'm going out with my gloves, I'm actually fully clothed from head to toe. And when I return to my home, it's the same, what they tell you, I leave things at the doorway, in my walkway. I disrobe, I immediately go wash my hands, and I'm just very precautious. But for me, as a woman living with HIV, and what I encourage anyone who is living is definitely to, our immune system is one of these things I say. Our immune systems are fighters, and we have to be protectors of our immune system. So stress can really destroy us. Anxiety is stress. And so right now, again, as I did talk about, I am very intentional about my breaths. I'm very intentional about my mindset, because I'm sorry, y'all, I swallow to look this good, take one pill a day. And what I refuse to do is lose a T cell count behind some stress. So I'm being intentional about, my space and what I do, and just being extra careful, but I'm not going to, allow myself to get down and out and really just stop and not function. It just looks a little different for me.
Thank you so much for that, Shadon. And before we move on from how to cope, I want to ask Dr. Shorter, are there any resources allocated to people at the margins, such as those that are dealing with substance use issues or with predetermined mental health issues? So we talked about those who've never engaged with the system. Are there any resources allocated to people that are going to, if you would, Narcotics Anonymous or Alcoholics?
Yes, all of those things. So I'm so glad that you are asking this question in particular. As I've mentioned before, my specialization is addiction psychiatry. So working with folks with substance use disorders or other kinds of behavioral addiction is one of the things that I feel most passionately about. So I was really glad to hear that you wanted to talk about this tonight. One of the things that we have probably been seeing or hearing about in the news is that Texas is one of the top states in the country that has had alcohol sales during COVID. It's not really surprising that people, when they are under stress, are going to turn to substances of lots of different kinds. So people relapsing on cigarettes, relapsing on alcohol, relapsing on all other kinds of substances. And then also combining that with other kinds of behaviors, particularly with sexual activity, is something that we are not unfamiliar with in our community, and something that we really need to try to support people through and love people through, and not try to attach so much judgment to it and come at it from a much more sex positive standpoint. Now, having said that, for our friends, for our family, for our loved ones who are really truly struggling with a substance use disorder, we know that it is unbelievably horrible, and the pain that they go through. Fortunately, it turns out that most of our 12-step support groups also offer virtual meetings. So in the same way that we can gather and congregate and share in this environment using Zoom, 12-step organizations like Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, Crystal Meth Anonymous, CMA, all of these anonymous groups are still meeting, still convening. You just got to go to the website and find a virtual meeting. Now, say you're one of those folks that says, I've tried 12-step, it don't work for me. I don't have a higher power. I'm not looking for one. Well, even for you, there may be a 12-step meeting. There are AA meetings that are for atheists and agnostics. Try one of those. Or you might try something like a secular sobriety group or something like Smart Recovery, which is not focused at all on 12 steps, but rather helps people to think through the ways that they can try to almost control their relationship to alcohol or other substances. I'm also going to plug the Montrose Center again because of their chemical dependency program. You know, one of the challenging things about accessing substance use disorder treatment right now is that a lot of that takes place in the context of intensive outpatient programming or residential treatment. Well, in the middle of a crisis where we really need to maintain 6 feet distance between each other, putting people in residential treatment is not like the highest priority in terms of safety. Now, that having been said, there certainly are some residential treatment programs out there, but really a lot of them are clamping down on that in order to keep people safe. So virtual IOP is something that's being developed and rolled out. You'll need to keep your eyes open for that. Finally, I'm going to throw in a plug for the Council on Recovery here in Houston, at councilonrecovery.org. They are also doing virtual visits and getting people, because they're more like you go to them for an assessment and then they say, here are your options. Here's what you can go to. These are the places that are taking in new clients, and this is what you can pay. Great. This is how much they cost. And they will do a full assessment and then figure out the places that are best for you. So I would try any of those places.
This is such good information. If you are currently watching, definitely share this with other people. But after we talk about mental health, because we know our persons of color, especially LGBT people, don't really like to talk about coping, y'all will watch that later. But this is the point that y'all want to start sharing. If y'all didn't want to talk about mental health, we are getting ready to talk about the new normal. In the new normal, we're going to talk about the stimulus package that everybody's waiting to understand. And we're going to talk about hooking up, because we know you're doing it. Let's talk about doing it safely. Okay. And so if you haven't shared the live, please share the live. We got some amazing information, and y'all gonna hear it either way, because we're doing watch parties all night and all day. Okay. So next, I want to ask specifically, what is the stimulus package and how does it work, Mike Webb?
Yes, so this is actually the largest economic relief bill in the entire history of the United States. And it's called we call it the stimulus package, but it's actually called the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. There are a lot of great things for us as a community in the stimulus bill or in the CARES Act, but there's also a lot of not so great things, right? That's how the sausage is made. So just to give a brief overview, 30% of the stimulus bill basically are going to be the checks that we all are expecting, right? That we all want like yesterday, in the amount of $1,200 max for the everyday citizen. I want to get into more details about that, but I'm going to say the word citizen specifically in this case because they're not funding or giving any assistance to anyone who's undocumented. 25% goes to large corporations, or an amount of $500 billion. And 19% goes to small businesses, which is also essential for those who, like Ian, who are entrepreneurs, and quite frankly, the coronavirus has already wiped their businesses out. 17% go to state and local governments to help support their sort of transition services. 9% goes to public services. Now, to break down the individual payments a little bit more, because I know that's what most people are interested in. As the media reports, the government is currently working on providing up to, and I want to say that clearly, up to $1,200 to each person in America who's a United States citizen. This is for individuals earning up to $75,000. That's very, very key here, because if you make more than $75,000, you're going to see a decrease in that amount that you're going to be issued. And it decreases by $5 per $100. I know that sounds very, very complicated, but every $100 that's over $75,000, you're going to get $5 less on your check. At $99,000, if you make $99,000 a year or more, you're not going to get a check at all. So they're already crossing people out. So at first we crossed people who are undocumented, and now we're crossing out people who make over $99,000 a year. That being said, if you're unemployed, you still can qualify for this check. But if you're currently still receiving $99,000, your job is still secure, you're not going to get a check at all. Couples get their own checks. That means like if you happen to be one of those LGBTQ people that got married, or you happen to not be one of those people who got married, you still would get a separate check. So they're not going to do a joint family check at all. That being said, they are giving $500 per child. So if you're part of a family or if you have dependents, you get $500 extra on top of your $1,200 check for every dependent child that you have to take care of. The easiest way to get your money as soon as possible, and they're talking about issuing out these direct deposits and checks as early as April 17th. So this can happen within 2 weeks or less if we all try to get on this as soon as possible. The easiest way to get your check, the easiest way to get your money is to file your 2019 taxes and to opt in for the direct deposit or withdrawal if you still owe the government money. And that's the way that the government can have your bank account information and they can immediately just deposit a check, hopefully on April 17th. This expedites the process and will help the Treasury Department get you your money faster. And I've said April 17th 3 times already, so I'm sorry for that. Things to note: you do not get a payment if you are claimed as a dependent. This is critical for those who are college students or those who are like 24 and their parents still claim them on their insurance and things of that nature. If your parent can claim they basically take care of 50% or more of your needs, they could claim you as a dependent and you would not receive a check. You must have a valid Social Security number to receive a check, which means undocumented families and their children will not benefit from this. Originally, the Treasury said Social Security recipients who do not normally file taxes because their income is so low would have to file in order to receive money. However, they've recently changed that. Okay. Although I would pay attention to that qualification because it's likely to change again. They've always, usually in the history of stimulus package, require some type of tax filing. But who knows? This is Trump era. We're gonna figure this out as we go. And people on disability, veterans, and unemployed will all get money. I do want to break down unemployment benefits a little bit, just because the stimulus package also includes additional benefits for unemployment benefits. It expands unemployment benefits as another key feature in the bill. The average American worker earns like $1,000 a year. I mean, $1,000 a week, and most state unemployment benefits cover 40 to 45% of those wages. The expansion in this bill is meant to cover that gap because 40 to 45% is not enough to really take care of the basic needs. And so if you are currently receiving unemployment benefits, you should receive $600 extra on top of your current unemployment benefits. That could fluctuate depending on where you are with your status, unemployment benefit status. Self-employed people, gig workers, freelancers, independent contractors, and furloughed employees are now covered under these expanded benefits. It also covers part-time workers, even if your state benefits don't. Those that lost work because they contracted COVID-19, cared for someone with COVID-19, and have to self-quarantine as a precaution because their children fell through, and they couldn't go to work or because their employer shut down. And so the stimulus package is meant to cover basically all the people who temporarily or permanently lost their jobs because the restaurants closed down and the bars closed down or the stores closed down, etc. As it relates to students' loans, and this is like one of my favorite parts, federal student loans are now waived until September 30th. Interest is also frozen and will not accrue during this period. This does not affect public service forgiveness programs nor credit reporting. The best way to manage this is to log into your loan service provider to double check and see what they're doing with your student loans. You can always tell them that you've been impacted by COVID-19 and they absolutely have to assist you in the best way they can. It's legal. They're legally mandated now. If I have a little bit more time, I want to talk about how this can help small businesses as well. It creates a new loan program called Paycheck Protection Program, which basically means that like if a small business promises and commits to continue paying their employees, the stimulus package, and they have to apply for this, of course, would support the payroll salaries, mortgage, rent, and utilities, insurance premiums, and other debt obligations cover businesses with fewer than 500 employees. Part of the loan can be forgiven for certain circumstances. However, businesses cannot reduce staff or their salaries within a certain time frame. And so this is a really special part of the stimulus package, because if you qualify, not only can you get this loan to basically save your company, save your employees from economic disaster, but it can quite frankly be forgiven as well. So it might basically be a bonus to an extent, but that depends on your specific situation. I can go into a lot of details about how this benefits large corporations. I don't particularly want to. If you have questions about how the Trump administration loves the large corporations, feel free to email me at mike.webb@thecaucus.org, and we can go to more details about all the deals that they made about this. But $500 billion is going to them, and that's a lot, and we're not going to ever see that. What does stimulus look like for LGBTQ communities? Additional $90 million for the Ryan White CARE Act for HIV, AIDS, and treatment. That was pretty good. Additional $65 million for housing opportunities for persons with AIDS or HOPWA. Require that Medicare Part D plans provide up to 90-day supplies of prescription medication if requested by a beneficiary or during the COVID-19 emergency period. Additional $25 million for carrying out activities under the Runaway and Homeless Youth Act, $4 billion for the U.S. Department of Housing and Urban Development Emergency Solution Grants, $5 billion in addition to funding the Child Care Development Block Grant, and $400 million in election assistance to expand vote by mail, early voting, and online voter registration. If you like those things that I just mentioned, that's gonna impact the LGBTQ community, those are all put into the bill by Democrats. And those are all put into bills by elected officials who support the LGBTQ community. And I think it's really important to highlight who puts the parts of the stimulus bill that supports corporations like Exxon, and who put parts of the stimulus package that take care of everyday residents and everyday LGBTQ community member. Because this explains why elections are so important. Some of us preach elections all year long, like myself. And then most of us roll our eyes when those like myself talk about elections or the importance of voting. And it's very understandable. We all have real lives to live. But this is why when we say elections matter, this is why elections matter. Because we didn't elect the people that we have elected, we wouldn't see these perks that we're gonna help us survive this COVID crisis.
And speaking of elections and political stuff, I wanna have just a moment to ask, since Houston is a fast track city, Crystal, how is this impacting the plan to end HIV?
Thank you for asking that question. And all of this information is so important and rich, and it applies to many, many people who are in the LGBT community and near it. And so last year, the Trump administration around February, they, made an announcement and said, we're going to end the HIV epidemic. And so here in Houston, we were already doing work since 2016. And so 2019, they made this announcement, which brought out many financial resources that we needed, because a lot of the work that we do to impact HIV in Houston, it comes from the federal government. It does not come from our local government. It doesn't come from local tax dollars. It doesn't come from state taxes. It comes from our federal resources. So they are pouring in money. It was like $375,000 for the first year for prevention, about $1.7 million for people living with HIV. So there's a lot of resources coming into Houston. And so right now we were beginning to do more engagement in the community to find out, okay, what is it that you absolutely need? We've been hearing from some of our more marginalized communities, like our trans and gender non-conforming communities, to really understand what it is they need to support the people who are living with HIV, but also we want to keep people negative in the first place. And so right now we're in the moment where a lot of our local health departments, our city and county, are all deployed to focus on COVID-19, and that's understandable. Like, nobody can focus on anything else but COVID-19 right now. And so a lot of their resources and time is focused on that right now. We're going to figure out a plan to move us forward, maybe at the end of the month or in May, but until we can get a handle on COVID-19 in Houston, we're just listening to what the community needs right now. So I guess that's the best way to answer that question. The plan to end the HIV epidemic is still a priority. It's just that we had to reprioritize because nobody was expecting COVID-19.
Absolutely, absolutely, absolutely. So I want to thank everyone so far, and now we're gonna get into some of my fun questions. Anybody know me? I am a self-professed former sex worker, and I have moved through this work because of sex work. I don't shy away or hide from the fact that I was a former sex worker, because I would not be here had it not been for sex work, because sex work is work. So, in terms of sex work, Jonathan, if you could tell us some simple steps to take when thinking about hooking up as we go through this COVID-19 crisis.
Awesome. Thank you for that question, because that it's so important to understand that for queerness, sex is a very important pillar of our identity as for human beings in general, or at least most of them. And I'll just take all the lessons that I've learned from my practice when it comes to prevention for HIV or HIV treatment, and always thinking about, what is your goal? And probably your goal will be us building together for you to have the best sex ever, right? And the interesting thing is we also have to remember that sex is something that looks different from everyone, right? So first is asking ourselves the question, how does sex look like for me, right? And how is going to look like for me during this pandemic and this social distancing, right? So the first thing that we need to just take into account, I think, is the fact that there's no treatment for this. There's no vaccine for this. And the best thing that we can do in order to prevent transmission is social distancing, right? So we just try to take the approach of maybe like when we just talk about sexual networks, right? If you're just thinking about hooking up with 5 people, those 5 people may hook up with another 5 people, and then you have some sort of exponential transmission, right? So again, I would thinking about that concept first of all, and then going from the outside to the inside, meaning if you are a sex worker, think about different ways to engage with that, maybe some sort of video chats, there are probably out there resources.
Chatterbait.
Yes, to engage with your clients in a different way during this pandemic, because it's taking care of yourself and taking care of your client. So the same thing if you're just thinking about opening Grindr and checking who's out there. And again, maybe instead of 5 sexual partners, just try to reduce them to 1 or none. And then just going back to these circles is like, okay, maybe you do have some sex partners and you decide to proceed, which I suggest with social distancing, is again, just find different strategies, right? Move on to exploring sexting maybe, right? Using your literary or exploring your literary beautiful resources that you have. There's so many beautiful emojis you can talk about. You can remind people about the good old times that you had with that person. I just call it a pit stop right now. And then again, your safest sex partner is going to be probably your household partner if you have one. So same thing when it comes to prevention. Don't go y'all together to HEB or supermarket, because I've seen that all the families going together to the grocery store, just one is enough. And then last but not least, the best sexual partner that you'll have is yourself. So again, this is an amazing pit stop to explore yourself and maybe get some good new tricks when this is over. It's not bad to, set the mood, and once again, learn something new about yourself. This is the right time. People just having to be inside, social distancing, and again, learning something new. I think that we need to think about that. And just it's amazing that it was so needed that in New York they made their own guidelines when it comes to sex, and just reminding people the need of social distancing, and that, for instance, we haven't found transmission in sexual fluids when it comes to coronavirus, but kissing is enough, right?
We need to share those New York guidelines. I remember seeing those recently.
Yeah, so I was going to say, Johnny, at the end of this, if you could put that in the comments, that would be really good. And then just send that over to me. I'll make sure, as we're sharing it on different platforms, I see my boss at my contract job, John Huckabee, is on. So I hope to hear from him at the end. But AFH will be posting it on their social media. So let's make sure we get that out to them. So thank you for that, Jonathan. I wanted to go to who I call the public health expert when it comes to sex, sexuality, and PrEP, Reese Caraway, the reason why we're here. I want you to go into a bit more of a deep dive into sexual education and COVID-19 as it relates to what is practical to be doing. Now we understand hookup, but if I do hook up, what should I be thinking about doing?
Okay, so it's funny that y'all mentioned the New York Health Department's guidelines on having sex during time. That's what I'm going off of too. The Houston Health Department has also adapted a form of that as well. But now, as in any other time, but now especially more, is the time to really experiment with barriers. Because when we know this is passed by saliva, it's passed by mucus, I believe, and it's also been noted that it's been found in fecal matter, which if you are MSM, a man who has sex with men, that's something that you're coming into contact with often, having anal sex. So if you never experimented with mutual masturbation, this is the time to do it. I've heard that mutual masturbation is good when you have on gloves and you're using lube. So there might be a time to use those gloves that y'all are loving to use right now. Just don't touch your face after you after you use those gloves. Dental dams are extremely beneficial. I did a live a week ago showing how to construct a dental dam. I have my toys over here, but I'm not pulling them out tonight. How to construct a dental dam from an insertive condom, using FC2 or female condoms for anal sex. If you're someone who doesn't like the traditional condom. So, and like Jonathan said, trying to limit our interactions. We want people to abstain from sex, but we know the more bored you get, the more sex you probably have. And there's not a lot of things we can do while we're stuck in the house. So I'm pretty sure y'all are having a lot of sex, but let's just try to experiment with those barriers, those gloves, those condoms, those dental dams, and whatever we're doing to limit, I guess I'll just say skin to skin contact with someone else.
Thank you so much, Reese, for that. Super. My mind is open, y'all, because it's important for me to understand what I can and can't do. Like, I'm not, just for a second, I just want to look into the camera and tell y'all that though I do this work, I am not above learning. Not learning because I want to learn, but learning because I need to know what I can do. I'm over here isolated and depressed. So we're going to a really important piece that I think that a lot of us, even if we don't know it, we're looking to find out more about, and that's the care and prevention, specifically around like anything medical, right? So I want to start with asking a question to Crystal and Stephen. If I am on PrEP, or specifically if I am living with HIV, how do I get medication if I am low?
Good question. Do you want to go first, Crystal, or shall I?
I think you can go first, and I'll just chime in.
Oh, okay. All righty. So if you're on PrEP or if you're on HIV medications, I say even if you're not on either one of those and you're a person that has to take medications on a regular basis for any kind of chronic condition, right now, check with if you have private insurance, check with your insurance plans, call them, and check with them, because there have been some loosening of some of the rules when it comes to getting your medications. Check with your provider, your insurance company, to see if you might be able to get more than just a 30-day refill. In some cases, you can actually ask and get up to a 90-day refill. And so just want to keep that in mind, folks, for right now. One of the reasons that is to put in place measures that prevent people from having to go out as much, at least once a month basis, go to places where there might be more people ill with either COVID or other contagious viruses are going on through the community at whatever point you decide to go out. And so that's a measure that's been put in place so you can get the medications you need and not put yourself at risk for contracting COVID or anything else that might be out there. So up to 90-day refills for folks who need those for chronic conditions and so on. That's the private insurance, if you have that. But also know if you are using the state program to access medications, the Texas HIV medication program, they have also loosened those rules to allow up to that 90-day access for medications for some of them. And so all you have to do is talk to whoever it is you already go to get your medications to see if they can work that out for you. For people with chronic conditions, another concern is, say we can get 90-day, but we still not so comfortable that to go down to the pharmacy to get the meds. You can actually request to see them, have them mailed to you. If your pharmacy is not equipped to mail them and you use that state program, the state program can hook you up with a pharmacy that can mail them to you. Again, these are our efforts to help people not get out in the community where they may potentially be exposed to COVID-19, particularly those with chronic conditions, HIV or otherwise. So keep that in mind. Look at your insurance plans, talk to your providers and see which of those you can get done for you. And if they can't, try to get some help. The other thing is, we understand there's a lot of people that, I'm going to talk to Mike about this a little bit, but there's a lot of people that may have lost their jobs. They may have had private insurance through their employers. If you have been in that situation, know that they, through the COBRA, being able to maintain their private insurance that you had through your employer can still be maintained by you. You just have to be in charge of paying those premiums. Now, we know at this point, if you don't have a job, that's going to be fiendishly difficult. It's already fiendishly difficult just to do that if you had to do it on your own with a job. It can be very expensive. But here in Houston and Texas-wide, there is a program, the Health Insurance Assistance Program, that can help you with paying those premiums so you can maintain that access to that private insurance that you had, even if you're no longer working for that employer. And different time frames, 6 months up to 18 months, you can maintain that access. So here in Houston, it is Legacy Community Health that has our local health insurance assistance program. So I would contact them to see if they might be able to help you with that. And if you're not in Houston and you're watching, then the statewide program can help you with that. There is, I sent Ian and Reese a link to the Texas HIV medication program. It's the one that ends in HIV STD /meds/document that they can get access to some applications where you would fill out and send in. About those applications, because of what we're going through right now, there have these emergency applications for medication assistance available to the public. You would go to that same site that I supplied to put in that link so people can get access to that application. It's in English and in Spanish. Through the Health Insurance Assistance Program, those co-pays you have to pay, not just the premiums, you possibly get some help with the co-pays, any other kind of co-payments that are in place. Some of those have been waived, and particularly for any kind of COVID response by insurance companies. So that's something I want folks to know about right there, that there is a resource for maintaining the health insurance you had. There is a resource if you do not have a health insurance for you to still maintain access to your medications. Ask for a 90-day refill to see if those can get those that way, and see if they can be mailed to you as well.
Thank you, Stephen. Crystal, did you have anything to add?
I think that was great. I knew Stephen would do a great job. I would just add that if you, and a lot of people who are already in care know about the whole renewal process, or what we call reattestation or self-attestation. They know this language. And so if you are due for that link that Stephen mentioned, we'll put it in the notes but you can go there and request an emergency application for medication assistance to complete that. And I just want to reiterate, a lot of people don't know about the services that are available to them. If you know someone living with HIV or not, there is a whole supportive network for you, no matter what your circumstances are in Houston. And so that's the Ryan White program. I just want to uplift that because a lot of people don't know that those resources are there for you.
Thank you.
Right.
Thank you.
One more thing, because you brought that up.
Real
Okay,
quick, if I really can, really quick, with ADAP, which is a state-funded program in Ryan White, but specifically with ADAP, right now they are actually doing emergency applications instead of us having to complete a 14-page application.
Right.
They are now allowing you to do a one-pager, and the medical provider that you are seeing just needs to complete a certified medical certification form. So instead of asking for verification of ID, verification of address, employment, and all those different things, they're actually foregoing all of that and allowing the person or the clinic in which you're being seen at to basically attest to that on your behalf. So that is a wonderful thing that is happening with ADAP, which is the state-funded program. And like you said, Crystal, for those that know that are already on the program, if it's time for a renewal, you actually can just call in and do the renewal over the phone. If it is time for extension, same thing, that is done over the phone. If it's time for your renewal, all you need to do is a one-pager. There's no all the extensions and all the long forms, and verification is being forgone at this point, as well as it was something else. Oh, and they are approving your medications for 60 days at your pharmacy. So just an FYI, I do work in that field. So yeah, I was able
exactly.
Thank you.
Exactly, Shadon. She is telling the truth. One thing about that also is that because of this, they are the Texas HIV medication program is prioritizing new applications right now. So everyone that is either recertifying or doing self-attestation forms and so on, you may not get an answer immediately, but know this: they've already informed your providers and pharmacy that they're experiencing some delays because they're focusing on those new applications. But to know that any of those folks in that situation are continuing to be eligible to receive medication. So whether or not they received a confirmation that you've been approved or not, they're letting providers and pharmacies know that these folks are still eligible. If they've already been into the system, they're just a little behind because they're focusing on new applications and enrollments.
Thank you, thank you. And really quickly, just in looking at the time, I know you guys are still engaged because y'all want to hear this, but I also want to just shout out AIDS Foundation Houston. They have this amazing, completely online, completely virtual program for people that are interested in PrEP. It's called Hey Mister. You can go to heymister.com. You will do everything through telehealth. They will send you your labs to do in your home for STIs and HIV. You send that back to them, and if something comes back reactive, you can get treated, but otherwise you'll get your PrEP right at your home, and you can do that completely virtually through heymister.com. Speaking of AIDS Foundation Houston, Jeffrey Campbell, what should I do if I'm missing appointments and labs?
So for individuals who have doctor's appointments that are scheduled, or if for some reason you need to see your doctor, it is most practices have already reached out to their patient bodies, and they've sent them emails or messages regarding how they're doing telemedicine appointments, how they are collecting labs. And but if your practitioner, if your provider, if your clinic has not reached out to you, reach out to your provider and find out if you have an appointment coming up. Is my appointment still scheduled? Will I have a telemedicine appointment, which is most likely what it's going to be? And then also determine what you need in order to be able to have a telemedicine appointment. A lot of folks are not technologically savvy, and we're having to learn how to be technologically savvy because of COVID-19. So if you don't know, reach out to someone. Everybody on this panel can help you with that process. I just had my first telemedicine with my doctor last week. And I kind of knew what I was doing, so it went well. But I understand that there are those people who are challenged with that and may think they don't have the right type of phone equipment or iPad equipment to do that. So reach out to somebody. Don't wait until the last minute. If you have a case manager, reach out to your case manager. If you have a social worker, reach out to your social worker. Regarding medications, call your pharmacy, ask them, say, hey, I've got half a bottle left, I've got 15 pills left. I want to know, I need to know what is going to be the process for me to get this refilled. For labs, again, talk to your primary care provider about how they're going to do your labs. I understand that LabCorp is still doing labs. I'm not sure yet how some of the clinics are doing labs, but I do know providers are still working on ways to provide all patients, regardless of your HIV status, regardless of your insurance status, if you're Ryan White or if you're private care, we are ensuring that people are getting the care they need. It may take a couple extra hours, a couple extra days, but we are working on all levels to make sure you're getting what you need. And I also want to encourage those of us who are on this call. I'm sending out an email tonight to my program staff because we know this stuff. I mean, I know COVID is new and we're being asked to do some new things, but a lot of what we're talking about, we kind of know it already. But when we're talking to the general public, let's slow down so that people can grasp what we're saying. A lot of people that are going to be calling us and talking with us, or that we're going to be calling, the anxiety level is going to be high. They're going to be dealing with, maybe they lost their job, they lost their private insurance coverage. They're going to be in a state that we've already talked about, and Daryl and Shadon did very well at that. Slow down for the people, all right? Figure out different ways to communicate so that people don't hang up the phone from you and be like, I don't know what they just said, and I don't know what to do, and I am hopeless. So I know we know what we're doing, but let's make sure that when we're delivering in a very thoughtful, kind, and compassionate way.
Thank you so much, Jeffrey, my Uncle Jeffrey, Pastor Jeffrey, if you would. So you answered this a bit, Stephen. If you could just take a few more seconds and reiterate this, because I'm thankful that you already have responded to this, but how does one pay for medication if they are furloughed or temporarily unemployed?
Right. So if you are receiving HIV care and you're going to one of the Ryan White facilities, there's 4 of them here in Houston, then talk to your provider about that. They'll probably connect you with someone, a case manager, who will help you with an application so you can get some assistance to pay for those medications. It could be, if you have private insurance, that they will link you with the case manager and they'll help you with those COBRA forms, which help maintain that health insurance, and so that they can start picking up those premiums, and also help you with the co-pays. So right there, that situation for you would be solved. And if you do not have private insurance, the same process would happen, except they would then connect you with the Texas HIV medication program, which we were speaking about earlier, that can essentially do the same thing. It'll handle those costs for the medications. And so those are 2 options for whether you have private insurance, that health insurance assistance program, or if you do not have private insurance, through the Texas HIV medication program. It is, as Jeffrey mentioned, is not something that happens overnight. It might take a couple of days to get some things done, but it's something that's there for you and can help you get access to those meds. One of the things about living with HIV, however, I'll say, because this is specifically HIV related information I just shared, is that if you are on a medication and you're almost out and you're going through that process to get that kind of financial assistance, those same folks that can help you get access to those means to help you pay for co-pays can also talk to that pharmacy. If you get your meds from that same provider, talk to that pharmacy about releasing some meds for you that day. And so just be aware of that as well. So if you're concerned about running out of meds before things actually come through for you, share that concern with the folks that are there helping you. They may be able to take some extra measures to make sure that you walk out of that meeting or the day after with a bottle of meds for at least 30 days.
Thank you so much. And our last question before we close it on up, Jeffrey, how are CBOs, how are community-based organizations operating with these new restrictions, knowing that a lot of our stuff is face-to-face? And then how are those current procedures impacting the way we work? You're on mute. You're on mute, Jeffrey.
I muted myself, I'm sorry. Thanks for that question. I want to say to the audience who may not know what a CBO is, that is a community business or community-based organization. That reference is usually tied to HIV prevention organizations like AIDS Foundation Houston, like AMA, like FLOSS, those types of organizations that provide HIV prevention services and linkage to care for persons who are diagnosed with HIV. So it's challenging right now to do HIV testing. However, what many of our organizations are doing, including AIDS Foundation Houston, is our folks are working remotely. They are staying engaged with our clients. I know at AIDS Foundation Houston, we have begun a process of contacting persons who have previously tested with us, particularly if they have tested positive for an STD, syphilis, gonorrhea, chlamydia. We're reaching out to them. We are reinforcing conversation around HIV prevention, STD, or sexually transmitted disease prevention. Our housing folks, AFH is a large housing service provider. We are ensuring that the folks that are housed in our properties are mentally okay, and that they have food and other resources that they need. I've been jotting down a couple of things that I'm going to send out to our case managers to check in with our housing clients on within the next few days. About doctor's appointments to ensure that they're getting what they need from their pharmacist and regarding medication. I will also say, and I want to reiterate what we are doing around prep care at AIDS Foundation Houston. We have a prep care practice. It is what I call, it's two parts. It's brick and mortar, where people actually come in and have appointments. They see Latrice Mason is one of our prep care providers. She's on this call. What we're doing, because if you're on prep, every 3 months, you should be having a new set of labs done in order to ensure that you've not seroconverted or you not become HIV positive, and you also get your STD labs done. We are scheduling folks to come in to a clinic environment that we are taking all the precautions related to preventing COVID transmission, and we are doing those labs. And our providers are reading the labs, they're renewing scripts for PrEP, Truvada or Descovy, whichever the patient is on. Also, you mentioned Hey Mister. Hey Mister is our teleprep portal that we offer to individuals who, we started out as like folks who don't want to come into a clinic, but now it's really what we're pushing, because we've talked about this. We know people are still having sex. Sex is a part of who we are. And in these times, anxiety and stress and fear many times drives us to want sex even more. So we want people to still be protected against an HIV transmission. So I encourage you, if you're not on PrEP and you believe that you're still HIV negative, go to heymister.com. I always forget it. heymister.com/AFH. And Mr. is spelled MISTR. Don't do the E. So it's HEYMISTR.com/AFH, as in AIDS Foundation Houston. You begin your process of getting linked to PrEP Care with AFH. I will tell you this, that we are, we're doing our best, not just to serve our clients at AFH, but we're also doing the work of ensuring that our staff are protected. And so that's for those who must have some type of engagement outside of their homes, not working remotely. We're making sure they have what they need to protect themselves. We're thinking of new and innovative ways, as I'm sure many of our CBOs and FQHCs are doing, in order to provide services. Because what is clear is that our populations that were already the most vulnerable are even more vulnerable when it comes to COVID-19. So we, as CBOs, and I know as this CBO, we know that we can't just sit down, that we have to continue engaging and offering information and services to our population here in Houston.
If Mike can add something to that, Ian?
Yes, really quickly before we.
Okay, so, and we can't forget the lessons that we've learned over the last 50 years, 30 years, 50 years, 100 years, that we know that people of color, folks at the margins are the ones that will probably least benefit from any developments we have in a positive way when it comes to COVID-19. So it's incumbent upon all of us to share what we hear and what we learn, so that the folks that are almost always left behind aren't left behind this time.
Absolutely, absolutely. And then following that, if we could have everyone give about 30 seconds of empowering words or final words, starting with Ms. Shadon.
I'll mute myself. Encouraging words. If nothing else, I just tell you to take this time and be still in whatever that practice is for you spiritually. Find out and listen to the voice that lies inside, to just be still, breathe, and love on yourself. Just love on yourself in this season. That's my advice to you. And like everyone on here, continue to be compassionate with yourself. And just know, if no one else tells you today, tomorrow, or the next day, I love you.
Love you.
Right? We love you too. Crystal.
So I think what I would just close out with a couple of things. I am really encouraged by what I see in specifically like the HIV community. They know how to respond to an emergency situation. They are ready, they have the information, and they are here if you are looking for a community. So find you a support network, find a community. And if you are someone like myself who is a little bit more introverted, like take a little step, meet someone in one of these Zoom chats, look at a live and explore and find a community right where you are in your own home. Find community, stay connected.
Thank you, Crystal. Latrice?
I'm sorry. I just want to say, everyone, to protect yourself, to really pay attention. This disease is very, very, very a serious disease, and we really, I really want people to stay home. I don't understand why people cannot stay home. This is going to drag out longer and longer and longer. And I speak from a person who has a small business that I want to get back to work, to some normalcy. And if we can't flatten the curve, then we're just going to continue doing the same thing over and over again. So please protect yourselves, stay home, and stay home.
Thank you so much, Latrice. Stay home, y'all. Dr. Shorter.
Yeah. So I would say that in addition to what everyone else has said, we always kind of say to ourselves, if I had more time, I would. What's in your blank?
Exactly.
This is the time where you don't have much else going on. You're probably sitting at home like the rest of us. So what's in your blank? If I had more time, if I only could just, I would blank and do it.
I feel like we should open up our Bibles to Isaiah 40. No, I'm playing. That'll preach though. That'll preach all day. The preacher in me got excited. What's in your blank, Mike?
What's in my blank? I don't think I want to hear that. But I do want to say that, one, thank you, Reese and Ian, for hosting this. To stay encouraged. I know there's a lot of anxiety. I know I personally have gone through a lot of anxiety. Then it's a very unpredictable time. And it oftentimes feel like our lives are not in our control anymore. But that's not true at all, because the people who are deciding what's best for the safety of our community are people who we elect. So I'm gonna remind everyone that our lives are in our control because we voted for our county judge, for our mayor, and for our governor. And to keep watch on who's doing what, and who's best serving our communities, and who's best serving large corporations, who's best serving us as individual activists, and who's best serving, people that donate to campaigns. Governor of Texas. So if you just take notes so we can hold them accountable in the future. If you have any questions, you need some advocacy, especially if it's LGBTQ related, please feel free to email info@thecaucus.org. I repeat, that's info@thecaucus.org. Or you can visit our website at www.thecaucus.org to find out more information on how we can advocate for you, because we're here to help our entire local LGBTQ community.
Thank you so much, Mike. I love the GLBT Political Caucus. Just became a member, me and Johnny. Super exciting. And so I also have, let me make sure before I go to a special guest that hasn't talked. Jeffrey?
Yes. Hey, so again, thank you, Ian. Thank you, Reese. I'm gonna say this, and this is gonna age me a bit, but when I started this work, we were hard pressed to get Black LGBTQ people together, leaders who were openly LGBTQ, to do something like this, and to have people who would follow and openly engage, and our allies, because I know everyone on this panel is not a part of our queer community. So I'm excited that in the midst of this all, and Stephen, I just hit your picture, our Black and Latino leaders. So I'm excited that we're here having this conversation. So 3 things, and some of you have already said something similar. Wash your hands.
Yes.
Sing happy birthday twice, according to Dr. Sanjay Gupta, while you're washing your hands. Stay at home if you don't have an essential job that requires you to be out. And if you are, go out, do what you need to do, wear the mask, wear the gloves, all of that, wash your hands. And then number 3 is something that I think is we need to hear. And those of you who follow me on social media know I have a hashtag, and that hashtag simply says you are loved. So out of our love for each other, let's check on each other. Let's check on each other. Let's text, let's call, let's say, we got time. We got time for some phone conversations now. Let's check on the older people in your life. If you have folks who are experiencing some form of dementia and Alzheimer's, check on them. the absence of people in their lives right now because of this shelter in place, it is impacting them. I know because I have an 85-year-old aunt who is experiencing that. So let's check on each other, let's love on each other, let's wash our hands, and let's stay inside.
Dr. Joya.
Yes. Okay. So as we all said, stay home, wash your hands. I hope you're all washing your hands before all this too. And try to stay away from all this massive hysteria and all the fake news that are over there around. I think this is a great time also to exercise our fact-checking abilities and to go to really trustworthy sources, the CDC, go to your health departments, because they are the ones, as Mike said, they're just leading us and leading the way with appropriate information. So just also be careful when you share stuff about everything that's going on. And again, just take some time also just, for yourself beyond whatever is happening in the pandemic. And also to acknowledge our own privilege from time to time, because it's really cute to post some Instagram new yoga that you're trying, but maybe your neighbor is struggling because he just lost their job, right? So I think it's a moment to self-cultivate, but also try to build community, empower each other, and to be really aware of what our community needs. So I hope we can learn a lot from this moving forward, because when this is over, I know we're going to be stronger.
Thank you. Thank you.
Yeah.
Before I let Reese give his beautiful last words, I wanted to see if the CEO of AIDS Foundation Houston, which is the oldest organization focused on HIV/AIDS in Texas, wants to give some final words.
Thank you, Ian. I just want to, well, first of all, I want you to see that I'm doing some social closeness with my baby girl here. And, but I just want to thank you, all of you. What an amazing town hall. My partner, Quan, and I have been listening to this all evening, and we've learned so much. And I just feel so encouraged to know that our leaders are leading and giving us good information and good counsel that we can take back. I know certainly I'm encouraged by our staff at AFH, by our volunteers, by the hard work they're doing in the midst of this crisis to keep delivering mission, to keep serving our clients. And I just want to thank you. I am so encouraged by everything I've heard tonight. So thank you so much.
Thank you, thank you, thank you. And then I wanted to lend the mic over to Reese to give his thoughts.
Okay, am I unmuted now?
Yeah, well, I can hear you.
So thank you all for participating. Thank you all for engaging and watching. And I've just been spending a lot of time with self. I know Jeffrey has talked to me about my mental health in the past. So I've been really taking advantage of this opportunity to nurture self, to be present with myself, to slow down and to stop, which oftentimes we move way too fast. And life just passes by. So I've been doing a lot. But my hope during this time specifically with my side of the community, and I think they know who I'm talking to, those of us who are dying to get back out and be socialites. I hope we take this time to really reflect and realize how much we thrive off one another. And I hope we come out of this with a greater value of community and how much we really need to be there for each other, because to flatten this curve and to get back to normal life is going to be collective work from all of us. And so that's all I have.
Thank you, Reese. And to close this up, if anyone knows me, they know that one of the things that I am the most proud of is being in community. And where that has led me is being the nominee for Male Identifying Pride Houston Grand Marshal. And just to be a nominee is super important because this represents us, right? This town hall represents us. It was so interesting when Reese gave me the idea and we began to talk about how this looked. He said, I want to call this us. Had nothing connected to like me being a nominee for Pride Houston Grand Marshal. It had everything to do with the fact that the work that we do is really about us. And so as we move through this feel free. All these people, I connected with them through social media, through Zoom, through conversations with work, through networks. All these people are accessible, including me, right? Reach out to us, because this work is about us. Flattening the curve is about us. Ending the epidemic of HIV is about us. Loving on each other is about us. Getting through the depression and anxiety and suicide is about us. And so I leave you tonight with, there is no one better than you for us. Have a good night.
Thank you, Ian.